Hi, I'm Patty Webb. I'm an MSN student in the Psych NP program, and my presentation is on equine-assisted therapies. If you'll move with me to the first content slide, many American health providers are heavily reliant on prescribing medication therapies, especially for mental health conditions like depression, anxiety, and stress disorders. This is linked to a more basic problem, a tendency to treat symptom clusters biologically, without adequately exploring patients' psychosocial, environmental, cultural, and economic experience, all social determinants of health. Complicating this in the mental health field is a three-part problem of access. First, underfunded and overscheduled community health centers. Second, a long-standing severe shortage of licensed mental health providers. And third, a persistent cultural belief that mental illness reflects personal weakness. How can advanced practice nurses expand access to psychodynamic as well as biological care for mental illness, while also perhaps finding new ways to embed more and better mental health resources into underserved communities? This review selected a prevalent group of mental health conditions, depression, anxiety, and stress disorders, to examine a psychodynamic intervention that has been applied to a population at growing risk, adolescents. The intervention is equine-assisted therapy, or EAT. It's an innovative complement to psychopharmacology that is also responsive to the problems of stigma and barriers to access among rural people. EAT sessions are built on structured, facilitated individual or small group activities between participants and equine partners. Also known as equine-assisted learning, or EAL, programs are often conducted on the ground with no requirements for prior horse knowledge or riding experience. They are designed to foster growth in self-awareness, questioning of assumptions, problem-solving, and empathy. Yet minimal theorization of EAT remains a problem, along with limited clinical trials demonstrating short and mid-range benefits. So moving to the next slide, the American Academy of Pediatrics, the AAP, defines adolescents as young people between 11 and 22 years of age. This decade of life is recognized to be developmentally stressful and characterized by high rates of depression and anxiety in the U.S. In fact, the AAP now recommends annual depression screenings for all adolescents, starting with the 12-year visit. Yet, according to Moeller and colleagues, the differential diagnosis for depressive anxiety and stress disorders outlined in the DSM-5 include overlapping and mutually potentiating symptoms. For this reason, studies that explore the efficacy of treatment in any of these formulations are likely to improve scientific understanding of the group of disorders and improve future care. The Healthy People Initiative has consistently devoted attention to mental health disorders as well, with prevention, screening, and treatment for major depression being a well-established priority. And under Healthy People 2020, the adolescent years have received even greater attention. So moving on to the literature search, a rapid review of intervention studies was conducted for animal-assisted therapies. Then EAT was selected as a focus because of its potential and its growing body of research. 6 controlled trials were identified, but only 1 was randomized. Not all Level 3 studies found significance between intervention and control groups. So a Level 3 study that did find significant differences was selected. The randomized trial, first by Frederick Hatz and Lanning, tested the effects of a 5-week EAL program on levels of hope and depression in adolescents identified at risk. The study used an EAL curriculum and standardized psychometric instruments. Data was strengthened by weekly measures as well as a 6-month post-intervention data point. The findings showed improvement in hope and depression measures, though statistical significance was initially weaker for depression. Yet 2 advanced analytic techniques revealed strong statistical improvement in depression outcomes compared to control. Moving to Morgan's 2017 quasi-experimental study, this tested effects of a 3-week EAL program on stress levels in older adolescents. The study was conducted in a college setting where undergraduate participants voluntarily chose enrollment in a 4-credit stress reduction course, the treatment group, or a 4-credit psychology course, the control. The self-selection process may have biased group composition, since students who perceive themselves at higher risk for stress may have preferentially selected the intervention. In addition, the intervention course included 3 stress management components, only one of which was EAL. Nevertheless, the study was structured to detect and analyze effect differences between components as well as between the intervention and control groups. It was thus possible to gain insight specifically into the effect of EAL. A positive and significant treatment effect was found relative to the equine component, as well as over the span of the semester course. While the three components demonstrated similar and perhaps cumulative positive effects, distinct and significant improvement in stress was identified in relation to EAP specifically. The relevance of these findings to advanced nursing practice arise from our profession's philosophical commitment to holistic and integrative care. APNs are equipped to promote innovative, humanizing treatment approaches that emphasize therapeutic relationships and resist depersonalizing effects of diagnostic and treatment protocols that are focused on managing symptoms more than treating people. EAT is promising in part because it is relational and humanizing. Patient participants are helped to comprehend their equine partners as sentient and responsive beings that likewise experience fear, uncertainty, anxiety, and distress. Bakke and Parrish-Plass have argued that EATs may hold special power for patient populations such as adolescents, who are difficult to engage and to render positive treatment outcomes. So in the last slide, we'll see two organizations that lead the way in responding to mental health needs in this area, PATH International and EGALA. Both groups have developed and tested protocols for psychosocial EAT programs. Advanced practice nurses in central Pennsylvania are well positioned to implement and test such programs. Equine facilities in the rural mountains away from mental health clinics can host adjunct care in the heart of an historically underserved population. Indeed, many equine facilities already host therapeutic activities and have interest in expanding their work. In Howard, PA, for example, Quiet Ranch Farm offers some mental health EAT programs and is a potential partner for other initiatives and research. Developing integrative psychosocial care outside the traditional healthcare system is a strategy for countering stigma as well. Horses are not often associated with mental health care, and their mere presence challenges preconceived notions of what that care is or could be. Conjoining psychotherapy with fun and adventure further disarms negative attitudes and lowers resistance to care among groups like adolescents. EAT merits further research and investment. Thank you.